Hello, we're going to go over your warmer, how you hook up your warmer here. You're going to want to roll it over to your gas outlets, your air and your oxygen. You're going to need to plug in the electrical cord. So once you get it close to where you want it, you want to plug in your air is yellow, oxygen is green, and you're going to screw these into the outlet. It might be difficult, especially the air one. You really got to really push that in until you can engage the threads, and then they start twisting on. And once you get that all the way on, you can do your oxygen 50 psi. Again, this is a lot easier to put on than the air. And screw that all the way in, and then you take your electrical cord on the back here and you plug it into a red outlet. So you want the red, so that gets the emergency backup power in case we have a power outage. And then there is a switch on the back if you want to come around back here, just in case it does not turn on the front. There's a power switch in the back here. You may have to flip that on if that is off and you don't get any power with the front switch. So that's the back power switch. Here is your power on here. And you see how we have no power? Oh, wait a minute. Maybe I didn't give it long enough. There it goes. Okay. Brief delay for the power turn on. It's going to go through its cycle of warming up and checking all its internal functions. And when it's done, you'll see the flashing emit baby. You just click emit baby, and then you can adjust your heater power up here, down, up or down, however you need for your baby. So once you have that set where you want it, there's lights that are on either side of here, and you can adjust that with the dial here, brighter or all the way off or anywhere in between. And then you're going to want to check your suction and your oxygen delivery, gas delivery here for your Neopuff, and there's a blow-by tubing that we have on these. These are just like flow meters that you would see on a wall with a flow meter. So these are just flow meters, and this is your oxygen percentage gauge to give. It's a blender, so you can give 21% all the way to 100%. But if you're giving a baby blow-by who needs oxygen, and you turn your gas on to give them blow-by, you always want to make sure you're giving oxygen if they need oxygen. Otherwise, you're just blowing air if you leave that on 21%. So this is oxygen to give blow-by oxygen at whatever percentage you need. Usually you have it at 10. I would run it at 10 liters per minute for blow-by, as NRP recommends. And your flow meter for your Neopuff, you want to run that at 10 liters. So it's easy to just remember 10 and 10, and then whatever you need on the blender for oxygen. This is your gauge for setting your pressures for your Neopuff. So if you need to provide CPAP or positive pressure ventilation, or even blow-by, you would, as you learned in NRP, you set this T-piece resuscitator up with the red cap on, like it was already on. So you put that red cap on, you make sure it's running at 10, and then you adjust your pressures according to your gauge here. So for your PEEP, you're going to go turn your PEEP exhalation valve to get 5 of PEEP, and positive is this way, clockwise, and you see the needle moving, so I turned it left minus, turns it down, and so you just turn it to where you get 5 there. And then once your PEEP is set at 5, you occlude your thumb on the exhalation port. That would be to deliver positive pressure breaths. You just hold it there, and then you're going to adjust your pressure to get, NRP guidelines are 20 to 25. So oftentimes I'll use 25 on late preterms and term babies, just to get enough air in there to begin with instead of trying to adjust later on. So you can start at 25 or you can start at 20, anywhere between 20 or 25. And once you have that set, then you're all set. You have your PEEP and your ventilation pressures ready to go. You just have to have your right size mask to go with your baby, a term mask or a preemie mask, and those should be with your equipment. So once that's done, you can set that aside. That's set. You can turn that off if you're not using it. Just remember, if you need it, an emergency or for whatever reason, you got to turn it on. This is your suction. So your suction pressure is 80 to 100, and your suction canister is over here on this side of the warmer. And this is the main suction from the bed that provides suction to the canister. And if you use these red ones, which I'm not familiar with, we use a different one in the OR, but this is pretty straightforward and easy because there's not multiple ports here, it's just two. So the top is for the bed vacuum to go hook onto, provide suction. And then the bottom one is just your tubing that you get from your supply room, wherever, to plug in here. And then you want to check your pressures with your manometer here. So you just kink it off and make sure you're at the right pressure. That's too high, so we would turn that down. There's 100. So you can let go and then test it again, block it off, and there it goes to 100. So anywhere 80 to 100, and then you have your suction pressure set. And you can have your catheters nearby, whatever, 10 French, 8 French. This one has a 10 French inside this bag, so I'm just gonna leave that over here, but you can turn that off if you're not using it. Just remember, if you need to suction your baby, you need to turn it back on, but now it's all set. So everything is set here and all your stuff is set up. And then you have a built-in pulse ox with these beds. So if you should need to put the baby on a pulse oximeter, you can use that right here on the bed. It has a pulse ox built in. You would plug that to your pulse oximeter on the baby, and you would turn it on right here on this little button, and that would show your pulse rate and your sat right there. This is telling you there's no SpO2 probe hooked up on the end of there, and that's right. We don't have one on right now. So I'm gonna turn this back off. So that's your sat monitor feature. So the drawers on the side is where you can keep your supplies and equipment you need. So you got your temp monitor probe cable, and this just plugs in to the side over here, where it has a picture of a baby and a thermometer right on the top there, and it only fits in one way. It's kind of easy to fit in and only fit in one way into there. And then you put the other end with the sticker on the baby's abdomen somewhere, and put the little piece of temp probe underneath that sticker onto the baby, and then you'll be able to monitor the baby's temp on the machine. So that's the temp probe. And it'll weigh the baby. I'm sure you're probably familiar with these. It has a scale built in, and you can, if you need to weigh your baby up here, you can hit menu, and you can go to scale, and then you can click weigh, and it'll ask you to make sure the bed is level. To make sure the bed is level, there's a little bubble on the side of these right here, and you need to adjust it, up or down with this little handle right in here. You just squeeze the handle, it can tilt the bed down or tilt the bed up, and you want to keep it to where the bubble's right in the middle so you can get the most accurate weight. And then it'll tell you to lift the baby. It'll lift the baby until it says replace the baby, and then it's tearing the bed, and then you replace the baby and it'll weigh. So that's how you weigh. Let's exit out of that. This is your APGAR timer. You can turn an APGAR timer on to have a timer. Turn it off. It'll beep at the 1 minute APGAR mark, and it'll beep again at a 5 minute APGAR mark, and beep again at a 10 minute APGAR mark. But if this is a postpartum application, you don't have to worry about that unless you just want to use it as a timer for something, heart rate or respiratory rate. And those are the main functions of the bed. You do have a procedure little light here that you can kind of zone in on something if you need to use a little light here, but that's what that's for. And that should be pretty much it.